Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Senior government sources suggested the cap on public sector pay could be reviewed in the next budget, saying the Prime Minister heard the message from the general election that voters are tired of austerity. The 1% cap was imposed by George Osborne in 2012 and hasn't been changed since. Joining us now is Josie Owen, Head of Employment Relations and Chief Negotiator at the Royal College of Nursing. Hello to you, thank you for joining us. What impact has this 1% cap had on your members?
Hello there. Our members have lost an average of £3,000 since 2010. They can't afford to make ends meet in many instances, and our hotline, our welfare hotline, is currently receiving about 8 calls a day from people who are in severe financial hardship.
This is a direct result of the decision by George Osborne in 2012?
This is a direct result of a 1% pay cap, and in fact for a couple of years there wasn't any pay increase at all. That's been in operation for 7 years. That's meant £3,000 at least pay real terms cut for most of our members, and that is a direct impact resulting from the 1% pay cap. And what we have to remember, of course, is that inflation is currently running at 3.7%.
Josie, I suppose what the government would say in response, and perhaps the Health Secretary too, is that we're in a time of austerity and everybody has to tighten their belts.
Well, I think Mrs May had it about right when she said that people are tired of austerity. In fact, I'd go one step further and say our members are sick and tired of austerity, and they're sick of not being able to have enough nurses in their workplace because they're not coming to the workplace, they're leaving the workplace, and that's all having an impact on workload and, of course, our members' ability to do their job properly and provide care for sick patients.
Funding also always an issue, though, isn't it? Funding is always an issue.
Funding is always an issue, but it's not our members, it's not nurses' responsibility to pay for a political decision not to provide the funding for the health service. And actually we just have to look at the consequences. Can the government not afford to lift the cap and ensure that there are sufficient nurses to provide safe staffing? Currently in England alone there are 40,000 vacancies, and our members' our fear is that that's leading to unsafe wards and unsafe conditions for their patients.
Just as we're chatting to you, Josie, just hearing in my ear actually that the Prime Minister's spokesperson telling us that the situation hasn't changed as far as this 1% pay freeze is concerned. She will look at it, but her position at the moment has not changed.
Well, I hope she'll look at it very, very carefully, because we're absolutely clear that the NHS is reaching a tipping point. 40,000 vacancies means fewer nurses on wards. It means dangerous staffing levels in some instances, and that's not good for either the nurses who are trying their best to deliver patient care in difficult circumstances. It's not good for patients.
Josie, good to talk to you. Thanks for joining us. Appreciate it. Thank you.
Thanks very much.
Thank you.